So I'm going to be doing trach care, and I will verify my physician orders, and I will knock on my patient's door, walk up in their room, and I will introduce myself, and I will use 2 identifiers. And then I will explain the procedure and what I will be doing. And then before I do anything, well, I would check to see if they want any oxygen or anything, but obviously they're not. So I'm gonna wash my hands, and I'm just gonna, for right now, put on clean gloves because I'm gonna use standard precaution, taking the old one off for the old dressing. I'm just gonna carefully take it off. And I would have a bowel bag, and I'll just throw it in there. Now that I'm got the old dressing off, I don't really need clean gloves anymore because I need to maintain sterility now. And I'll throw that in the bowel bag. Now, I will open this, and I will only touch the 1-inch border. Yeah, that's the shiny side. So the shiny side is gonna be down. And I'm pretty much gonna dump everything that's up in here on here. And I'm gonna save this because I'm going to take my normal saline and pour a half in here, and then I will fill these 2 compartments up with that. And I will take my peroxide and I will pour the rest of this half up in here in this compartment with the normal saline. Now that I did that, these gloves weighing weird, but we're gonna try. I guess I can take my gloves. Oh Jesus. Look how they lay. Let's try it this way. Okay, there we go. We're gonna done my sterile gloves on. I think it's these funny. Oh God. That's the phone. Well, we gonna continue. And I'll put this one on, step back. Now I gotta maintain sterility now. I'm gonna go ahead and set everything up. Make sure it stays in a, what's the 1-inch border? I mean, with not at the 1-inch border. Got my ties, got everything I need. And I'm gonna go ahead and I'm gonna have a clean and a dirty hand. This is gonna be my dirty hand. And I'm gonna carefully unlock the inner cannula, and I'm gonna take it out. Make sure I don't touch the inner cannula part, that part right there. And we're gonna let it soak because it needs to get cleaned. And while that's soaking, I'm gonna take one of these swabs and dump in some normal saline in one of the compartments. I'm gonna come over here. I'm gonna clean top from bottom. Throw it in the bio bag. I'm gonna take the other one, dip it in there. I'm sorry, girl. I'm gonna come around and get under there. Throw it in the bio bag. And now that's done soaking, I'm gonna pick it up. And I take this brush. Ooh. And I'm gonna clean the inside of it. Okay. And then I'm gonna let it rinse, and not in this one because I already used it. I'm gonna use it in the other one. I'm gonna rinse it off. Take one of these gauze and I'm gonna dry it and put it away. I'm gonna put it back in a downward motion, and I'm gonna lock it, and it's done locked in place. Now that I cleaned it and I cleaned the inner cannula, I'm going to take, I don't know, there it is, my clean hand, and I'm going to take this one, the new dressing, and I'm going to put it under here. It's hard to get out there with one hand. Okay. Now we got the trach ties left, so we're not going to take the old ones off, but we are going to go ahead and put on the new ones. Okay, I would just put it on and then come around, and then I would tie it here, and then I would make sure, after I done tied it, I will make sure that I can fit 2 fingers under there. And after it's a good fit and I can fit my 2 fingers under the new tie I have on, I can cut the old one off. And after that, I would take my sterile gloves off. I will make sure that my patient is okay and see how she tolerated and make sure she's not in distress or nothing. And I would put her back in a comfortable position and make sure the bed is in the lowest position, side rails up ×2, and I would throw everything away in the bottle valve bag, and I would go document.